why there is a need of postmortem examination in small ruminants, how to conduct a systematic postmortem examination, and also we should know some basics in the description of the gross lesions, and what are the importance of the sampling, and a slight touch on the veterological cases and approach. Firstly, why I should perform necropsy. Necropsy helps us to plan a prompt therapy for specific diseases, and in the academic aspect, it helps to improve the understanding of the disease effects and how severe it is, and depends on the lesions. And also further, after identification, it helps in control the diseases. So from this, the dead ones save the lives in a form. And importantly, it serves for the legal functions, legal issues, and mainly in the field, it will be very much helpful for the insurance claim. Then before going to the actual postmortem, our small brief guidelines, our personal safety is very much important. So while going for any postmortem, take your PPE kit, that is personal protective equipment kits like your gloves, mask, and wear goggles. These are very important. And minimal basic equipments. Actually, in the field, you may not have more of equipments. A simple scalpel blade is sufficient, or else your small scalpel blade along with a PM knife is sufficient to have a postmortem. Then while opening any animal, you should know the size, orientation, and color of the normal organ. Once you know the normal, then you can able to easily identify the abnormal things. And depends on the history or the clinical signs, you can concentrate the organ relevant to that clinical signs. And another important thing over here, always write a note on a brief telegraphic words. You make it a point in to take the notes, because that is very important. Means after a week, if you are starting to write the necropsy, you may forget 50% of the lesions. So it's better always you try to have an assistant, or by yourself you have a make a short telegraphic notes about the lesions of the animal. And another very important thing, nowadays everyone are having these smartphones. Take a picture of the lesions. Pictures are very much important for documentation. In any postmortem, we always have to follow these 6 steps. Consistent routine entails is very important. First and foremost thing in any case, obtain the proper and complete history, because the history itself gives a 50% of the diagnosis. So try to get or interact with the owners or interact with the herd persons to get a maximum history. What are the clinical signs, when it started, how many number of animals died, how far the course of the disease, like that you try to get the history. Then while opening, before opening, you thoroughly examine the animal externally. Then you start to open the body, remove the organs one by one and set aside. In the field, I know it will be very difficult, but try to take some time and keep the organs separately, and so that you can able to visible the lesions. Then examine the individual organs and take the samples of the organs. Finally, you write the report for to get an appropriate diagnosis. Coming to the systematic approach, as I said, thorough external examination is very much important. In the thorough external examination, you have to observe whether the animal is condition of the body, that is, it is obese or emaciated. Emaciation itself gives an idea of how far the animal is going through, that is, whether it is an acute condition or it is a chronic condition. The debility or inanition will indicate some clue. So if it is a insurance animal or anything, you take a note on the tag number and the color of the animal, and also the horn indications, whether it is a male, female, everything you please take a note. And also at the same time, you just check for any secretions or excretions are present in the natural orifices like mouth or nostrils or anus, like that. You have to check for the external examination. In the external examination itself, have to check the conjunctival mucous membrane. Conjunctival mucous membrane itself gives us some pathological process in the body of the animal. If it is congested or it is completely blanched, that indicates severe anemia. Anemia might be due to any hemoprotozoan diseases, like that. And you have to thoroughly check the oral cavity, whether any ulcers or hemorrhages or pock lesions, like that, is there or not, like that. Thoroughly check the dental pad and also gums, commissures, tongue, everything you have to check in the systematic approach and the external examination. And coming to our ruminants, you must have to check the interdigital spaces or the hoof region lesions. The animal might have prick with the thorns. So the next important organ to check the female animal is the teeth. Teeth is like our udder is very important because the small ruminants will be having the gangrenous udder that might be due to the staphylococcus that causes a blue bag or gangrenous mastitis. So now we have set the stage for the opening of the body. As it is a ruminant, the sheep has to be placed on the left side or it can be placed on the ventral side also. Firstly, we have to dislocate the shoulder joint area. Then we have to open up the subcutaneous skins. So after that, we have to open the subcutaneous area. Then followed by that, make a nick on the xiphoid cartilage area towards the perineum area. Gently remove the skin and this peritoneum. Then you check for the any dislocation of the organs or the immediately after opening a body cavity. Is there something will strike out from the other normal area, so that could be your important lesions. So like these are the organ in placement like a lung, heart in place or with a normal thing. Then removal of the plug. After opening the thoracic cavity, we have to take out the plug. Plug indicates your trachea, then heart, liver, lung. Here you have to make a nick in the intermandibular joint, intermandibular area, pull out the tongue and remove the all soft tissues. Along with the esophagus, you try to pull out and at the entry of the thoracic area or the diaphragm, you cut the esophagus and take out the entire plug that includes your trachea, esophagus, and lungs and heart. So this is the removal of the plug. Here we could able to see the organ in position, your lungs, heart, and then trachea. Along with that, esophagus will be there beneath. Here, this is the normal lung of the sheep. Here you could able to appreciate the color is of a pink color. The next lung is a completely pale pink that might be due to the anemic stage. It might be of any hemoprotein disease or it could be of coccidiosis. The next slide is anterior lateral lobe of both the lungs are affected. That means it might be due to the any of the infectious conditions like it could be of PPR and other conditions of the thoracic respiratory organs. After that, you have to cut open the thoracic organs to check whether the lung is edematous or pneumonic changes had been started setting like that. So if you open up the trachea, there is a lot of quite lot of frothy fluid will be there. Actually, small quantity of proteinous will be there, but when you see a copious amount of exudate or it could be a wet lung, you can appreciate an enormous amount of proteinous trachea that will extend into the lung. And if you make a cut section, there also you can able to see the enormous amount of frothiness in both the lung cut section. Next thoracic organ is your heart. In the heart, you have to take out and make a cut of the pericardium, and in that you can able to see if there is any clot formation is there or not, so that you have to examine the individual organ. The second heart image is a normal heart that is having a good amount of coronary fat in the position and good blood vessels. The color of the heart is a dark red appearance. This is a normal heart. So in a healthy animal, it has to be like that. If the animal is undergoing some chronic conditions like jaundice disease or TB or some other inanition, starvation, means the coronary fat will be utilized and it will be completely gelatinized, transparent jelly-like appearance will be there. If you could able to see the heart like this, then it will be a indication of inanition or any chronic wasting diseases. And the heart color is also will be mild pale and a jelly-like appearance of the fat will be visible. After the coronary fat examination, we have to check for the presence in the epicardial hemorrhages, subepicardial hemorrhages or petications will be there. That also indicates the septicemic appearance or septicemic conditions ongoing in the animal. Then next slide, this slide indicates the identification of the left ventricle and right ventricle. That will be very easy. You can able to identify the left ventricle based on the thickness of the ball because of the pumping capacity. Next organ to be examined is the esophagus along with the plug. This is a picture from a top, but still the same lesions. The bloat line you can see in small ruminants also. In a bloat, any bloat condition, frothy bloat. This is your thoracic part of the esophagus, and this is your cervical part of the esophagus. Whenever there is a bloat, the rumen will be engorged severely, so that it will compress the diaphragm, and because of that, there will not be a blood supply to this area, so that it will be appearing as a pale appearance. And as there is a compression beyond in the cervical part of the esophagus, that will be due to the hemodynamic derangement. There will be congestion and severe hyperemic reddish appearance will be there in cervical part of the esophagus. There will not be a clear cut line between as like indicated, but you can able to appreciate the demarcation between the congested part of the esophagus and also this thoracic part of the esophagus. Then coming to the abdominal investigation, firstly we have to remove the entire GI tract. Then we have to open up the abomasum. Actually, the small ruminants having 4 compartments, but still firstly we have to open up the abomasum. That is very important. Like in the abomasum, you examine the true stomach, then rest of the stomach has to be examined. I want to add up one point over here. In ruminants or in any animals, the most of the diseases are contributed in the GI tract. Actually, there was a study in cattle that also may be applicable here for the small ruminants. The GI tract contributes more than 45 to 50% of the disease condition, and around 20 to 20% was contributed by the thoracic organs like a lung. So in total, about this respiratory system and the GI system, maximum disease were being investigated or occurring in this 2 system only. That is about around 60% were present in this GI tract and the respiratory tract. The followed by that, you can see any urogenital system or the external skin and mange, like that. Other diseases will be contributed. Here coming to the stomach investigation, abomasum, true stomach is followed by that omasum, reticulum, and then your rumen has to be opened up, because rumen is so much voluminous. Firstly, if you open the rumen, then you will miss some of the lesion in rest of the stomach parts. So that in the abomasum, like next to the stomach, we'll see one by one. Next to the stomach, open intestine, it has to be opened. In general, the intestine has to be opened in 2 parts in the small intestine and 2 parts in the large intestine to check the presence of any of the parasites or any lesions like hemorrhages, congestions, or any obstructions like that. That is at the level of duodenum and jejunum in the small intestine, and at the level of cecum and colon in the large intestine. But if you suspect a primary signs in the GI tract, then you have to open up the entire intestinal tract and collect the fresh fecal and small intestine material for any parasitology or any microbial cultures like Clostridium or some other bacterial infections. Actually, in this slide, there is a mature amphistomes are there. This we can see enormous amount of mature amphistomes in the rumen. That is not a problematic one. It will not cause the death of the animal, but you have to see the duodenal part. There will be enormous multiple raised nodules will be visible. That is caused by the immature amphistomes. That is the culprit over there, which will cause the death of the animal. Here the intestine showing severe hemorrhages, and this is the picture which I mentioned, immature amphistome, which will cause the multiple raised small nodules in the duodenal part. This is a important lesion you would have to check in the amphistomes. This might be this intestine entire mucosa showing hemorrhages, that is due to the clostridial infection. Here is the amphistomes. Amphistomes you can see in the abomasum, that is our barber pole wire worm. It is the most important parasite that causes severe anemia in animals that leads to the death. So next one is this picture is mature amphistomes. As we already saw, this will not cause death, but this immature form will cause death. In any of the your intestine is severe hemorrhagic, you suspect for the coccidiosis. Those pictures are the oocyst, medial oocyst, and other the fecal material is having the tapeworm of the monocia. The next organ in the abdominal area you have to check is that the spleen. In the spleen, you have to see the size of the spleen, and also is there any lumps or the mass is there. You have to cut open to check whether it is a pus or like a necrosis or some other lesions or tumor like that. Then next important organ in the is the mesenteric lymph node, because mesenteric lymph node enlargement indicates the disease condition called an important viral disease in PPR. This mesenteric lymph node has to be examined. And coming to the liver, you have to check the evenness, whether it is having a rounded edges or smooth, sharp edges, and color, whether it is dark red or pale or icteric. And definitely liver, along with the liver, gallbladder has to be examined. Here, the liver or any parenchymatous organ has to be made into a serial slices. Like my sir always used to say that it has to be sliced into bread pieces like that, so that you can examine whether any nodules or cyst or the parasite like liver flukes can be examined at that area. And the kidney, you have to check the capsule whether it is tightly adhere or it is peeled off. If it is tightly adhere, means that indicates there is a nephritis condition. And also you compare the size of the two kidneys, like whether it is symmetric or asymmetric or multiple raised cyst is there or not, like that. And also the discoloration. After that, we have to check for the genital tract and the bladders. Like if there is any abnormalities, you cut open. Always the bladder mucosa has to be checked for the stone formation or ulcers, like that. Then before opening a urinary bladder, collect the urine along with the syringes. Then you go for the test. For example, the diseases like enterotoxemia or rabies, then pregnancy toxemia can be identified with a simple collection of the urine. This is a liver cut section. As I said, it has to be made into a severe bread slices. Here you could able to see the lesions penetrating into the parenchyma, and here the liver fluke was present inside. After making the slice only, we could able to identify the liver fluke. This is a case in which we had seen the presence of glucose. The first is the urine, and second is the negative one. And this is showing the grading of the amount of glucose present in the urine. So here the mild presence of glucose indicated by the green color, and a severe presence of glucose is present by the dark red or the brick color appearance will be there in the last one. These two are like 1+, 2+, 3+, and 4+, like that we have to grade it. Along with these conditions, another thing we can do for the ketosis also you can see, or hematuria and hemoglobinuria also can be examined at the basic level. Coming to the optionals, after all these investigations, still you could able to frame out what may be the disease condition. Then we can go go for these are the optionals, like bone marrow. In any putrefied animal or decomposed animal, if you suspect for pasteurellosis, you go for any of the long bone marrows. Especially the proximal femur will be most appropriate for the examination of the pasteurellosis. Even after more than 10 days or so, we can able to get or isolate from this bone marrow. Then coming to the CNS investigation, still we are having some inconclusive signs, or means you check for the you ask for the neurological history. That is for important diseases like rabies or polioencephalomalacia, listeriosis, like what kind of feed they had given, or and also polioencephalomalacia depends on the season. Yeah, means after the monsoon season, due to the less pasture, means it will have a less content of vitamin A. So all these you please correlate along with the history, clinical science, and go for the examination of the lesions. In any metabolic conditions like any toxicities like magnesium, calcium, urea, nitrate poisoning, try to collect the ocular fluid. For example, nitrate, you can see in ocular fluid, that is a diethylamine test you can do even after the 10 days. That will not deteriorate from the ocular fluid. And least consider this musculoskeletal system, including the diaphragm. We can check the musculoskeletal system. You can check during any trauma, though the diaphragmatic hernia will be there. The toxicities or poisoning cases try to collect the stomach contents and the intestinal contents and all our metabolic organs like liver, kidney, skeletal muscles or fat that should be importantly collected in saturated saline solution. So these are the systematic approach how we have to go for the examination of the animals depends on the lesions. So the researchers or the academicians always depends on the field personnel because the field is like a Pandora's box. That means if you open up the field condition, it will be, you can't say the same as a textbook. The lesions or the clinical signs will be there in the field. It will give you a lot more than that textbooks. So try to observe the clinical signs and also the lesions. Then next important thing is the quality of the sample and the information of the samples accompanying the samples is very much important for the researchers or the academicians so that we can try to make out the proper diagnosis so that means how better you are submitting the sample, the better you can get the results like that. While coming to taking the samples, there is a slight tips. Any of the solid organs, for example, your liver and the kidney has to be cut with a sharp postmortem knife so that it will not deteriorate the tissues. So exactly sharpness will be there. And like coming to the soft organs like your lungs and also the spleen, it depends on the condition. If it is congested or highly emphysematous, then you go for the scissors or else that has to be cut with a sharp knife. Here the lungs is has to be the lung sample has to be taken with the scissors and the parenchymatous organs has to be taken with a knife. So while taking the lungs, if you cut with a knife, that will deteriorate the tissues so that in histopathology you can't see the actual lesions. And coming to the lesions, you always try to cover the normal along with the abnormal lesions so that I had shown in the last pictures that is the appropriate or the means a very correct sampling for the histopathology so that we can try to identify the tissue also and also what is the abnormality. For example, if you are taking only the lesioned area, if it is a tumor, we can able to give only the tumor. We cannot find what may be the organ, whether it is a liver, kidney or the lung. So always try to take a normal along with the abnormal lesions. You have to be aware of the lesion recognition. That means here the first cut about the A that indicates the postmortem cut because there is no hemorrhage or any blood clots or not swollen. But the actual lesion that is the B indicates the actual lesion. That here you could able to see the hemorrhages and swollen area. Here the downside also you could able to see some hemorrhages and blood vessels were very much congested. So that you have to be very much careful where is the lesion and which is the artifacts like that you have to differentiate. In the intestine, if it is a intussusception, only that intussusception area only showing passive hyperemia. If it is by the systemic means the whole of the disease condition like enterotoxemia means whole of the intestine will be involved. Then this slide regarding the description of the gross lesion, always you try to see what kind of the organ means. Then after going to the organ, you check the consistency whether it is hard or soft, firm, and also try to write the color and size whether it is means a size comparison. You can go for like a example of tennis ball size, a cricket ball size like that. You can make out, but always keep it in a measurements like a 3D example. For example, this is a spleen. It is of about more than 10 to 10 and also round big mass at the posterior or the posterior part of the spleen like that we have to mention. And also it has to be given the symmetry. If it is a paired organ, you try to give the symmetry of the lesions. This is another example for how to describe a lesion in an organ. This is a liver. If whole of the organ is involved, then it has to be say as a diffuse generalized one. Or if any of the right lateral lobe or left lateral lobe is involved, means you just mention as a lobar or regionally diffuse like that. Or in that lobe, if it is only a specified part is involved, means you mention as a focally localized. And if the lesion is present all over the liver, but it is a like a small roundish, means it is generalized multifocal lesions on the liver. Or if it is only one lobe, but it is focally involved, means localized multifocal, like that you have to mention. Zonal we can see in histopathology. Then what are the components while writing the morphological description? Always you have to follow these things, whether what organ or what tissue affected, and severity. The simple words like mild, moderate, or severe, you have to write it. That means only a portion of the liver or lung is involved, or half of the liver involved, half of the lung involved, or complete entire organ involved, means mild, moderate, severe, you have to grade. And also you try to identify whether it could be of acute, subacute, or chronic, depends upon the material deposited over the lung, or whether it is only a simple hemorrhage or coming to the fibrinance, means that is a chronic. Like that you have to indicate the time of the lesions. Then distribution, as we see in the previous slide, whether it is diffuse, multifocal, or local. Along with that, you add up the pathological processes, like whether it is of fibrinous inflammation or purulent inflammation, suppurative inflammation, or if you really suspect it is not of a inflammatory condition, then you write a neoplasia or necrosis. These are the example for the pathological process, like fibrinous inflammation, granulomatous inflammation, necrotizing, proliferative lesions, like that you can add up while writing the postmortem. The next picture is a lungs. There you could able to see the severe deposition of a fibrin material along with the hemorrhages. That indicates like it is showing lung severe chronic fibrinous inflammation of the lungs. That indicates the chronic condition. Wherever there is a fibrin deposition occurs over, it indicates the chronic condition. Then now we can have a one gross description. For example, as we saw the previous one, what are the components like organ, location, distribution, size and extent, shape and color, shape and contour, color, texture, strength has to be mentioned. This is a means a description. The cut section of the kidney contains a single, here you can able to see single localized lesion in the anterior end of the, that extends from the mid medulla to the capsular surface. It is approximately 1 to 2 centimeter diameter, involving 5% of the renal tissue. Mostly it is of a triangular in shape. It is demarcated, well demarcated. You can appreciate the normal tissue adjacent to the lesions, and it is a flat. That also you have to mention whether it is flat or raised or depressed, because if it is a flat means if it is depressed, something is lost out of the that area, or if it is raised means something is added to that area. It may be of pus, or it may be of a granular tissue, like that. If it is atrophied, it will be depressed. So you have to mention that also. And color, it is a tan with dark red margin, that is well demarcated, and it could be of the texture is softer than, but remains the strength of the adjacent tissue. So after reading these lesions, you can able to identify, or you can get a picture in your eyes what may be the lesions, because the laboratorians, those who are seeing your sample or seeing your description, they could able to get a picture of the lesion. So like that, with the simple wordings, you can make out a description of the gross lesions. Then coming to the postmortem writing, I would have a clear, crisp, short wording, and it should be free of unnecessary jargons. That means you should not write like a serial parallel incision. These are the procedures that should not be written in the postmortem report. And also the jargons like there is located, measures, not noted. These kind of words are not needed. For example, this examination of light royer ledge shows that there is a firm inconsistency mass that measures about 4 into 3 centimeter, like in dimension and red in color. This much big sentences is not needed in the report. A firm red for this measurement mass is on the right lower leg. Like that, it has to be very short. Means if an example we can tell, like your postmortem report has to be very crisp. If you throw a stone like that, it has to create an impact. Don't throw the sand, like throw a stone like that. Then the lesions which you described in the main text, that should not be coming to the morphological descriptions. that should not be interpreted as a diagnosis. Till now, we had seen the gross description and how to write the postmortem. So with that itself, we can have, along with the history and gross lesions, we can able to get some with the pathognomonic lesions, we can able to identify few diseases. Why the histopathology is needed? Here, this is a picture of liver with a multiple raised nodules, starting from the size is about 0.5 to maximum of 5 centimeter also. Red to tan, yellow, congested nodules present in diffusely all over the liver. By seeing this, anyone can suspect it could be of tumor also. So if we take the section, then we could able to appreciate in the histopathology whether it is tumor or not, like that. Here, this is a lung which is showing a cacheated mass. If you suspect it is a pus or a cacheated mass, you try to spread with your knife. It will spread like a butter, so that it will be very smooth and its texture will be very smooth. It will easily spread over the knife. But if it is a tumor, or if it is like a fungal infection, then it will be of a granular nature, so that you can easily differentiate by spreading it on the knife. If as I said, if it easily spreads, it could be of any necrotic lesions. If it is not spreading, then you think about it could be of neoplasia, or it can be of fungal lesion that will be granular. So in this itself, you can able to take a impression smear and go for acid fast and check whether his TB organism is present or not, like that. Or still, if you want to confirm, like you go for the histopathology also can be done. So to see the granulomatous changes, typical granuloma formation means starting from the central necrosis surrounded by the dead neutrophils, then epithelial cells, followed by that. In the previous slide, I had kept for that histopathology of the granuloma also, so that you can able to clearly see the central necrosis followed by the epithelial formation, then the severe giant cell formation will be there. And again, why there is a histopathology? This also looks like a same TB or cirrhotic conditions, because this looks like a miliary TB. But if you go for a histopathology, in that histopathology, we could able to see some different things. So then we this is a case diagnosed in Madras Veterinary College. They identified it's a so next slide. In histopathology, they had done a special stain. In that, they could able to appreciate the fungal hyphae, septate hyphae in the Gridley stain or GMS stain. This is the exact picture that is showing the previous slide, that is showing the fungal hyphae that is due to the aspergillus infection. So in such a way, histopaths are needed. Means histopathology is needed to confirm the cases. Not only always histopathology is needed with the specific lesions, you just try with the simple smears itself. If you could able to see the punctuate lesions in the abomasum. Here in this picture, you could able to see the multiple clear-cut punctate lesions. Then you go for the examination of other organs, like whether the liver is icteric, gallbladder is showing some icteric, thick viscous bile. Then you try to take the peripheral smear or like a hard blood smear. Then you check for the presence of the theileria. The RBCs, which is showing the theileria annulata, small annular ring, the round appearance, means a signet ring appearance or annular form will be visible in the blood smears. Still, you can see the in the lymph nodes, lymphocytes will show the Cox blue bodies. In such a cases, if you suspect, you try to take the lymph node aspirate also. In that, we can able to see Cox blue bodies in the lymph node lymphocytes also. And what are the don'ts in histopathology? So you, as of now, you might have done very good postmortem and you had done a good report writing. But the thing which you, what you will do in a hurry or in an excitement, you will take the sampling. The first thing, always avoid the glass bottles, because you might be sending in a glass bottles, but while reaching the lab, it will not go in a form. It will be broken. Or if it is a very big lesion, don't try to send the full lesions. Of course, full lesions are needed, but if you are sending the full lesions, you try to make a serial incision, or if it is a capsulated organs, you make a prick or perforation, means put with a knife or any needles. You try to help the formalin to penetrate into the tissue so that there will be a proper fixation has to be there. And another thing, always use a wide mouth bottle, because while keeping the as the organ is fresh, it will go in this narrow mouth bottle. But after it is fixed, when we are taking out, it will be very difficult to take out the your samples. Then again, it will be a problematic one for to conduct the histopathology. And also try don't send in your means injection vials or syringes or the EDTA vials like that. Then because you had done enormous work that will go waste while seeing in the laboratory. As I said, you had done taken the sampling. You have to take as a 1 centimeter, means starting from 0.5 to 1 centimeter is sufficient to see in histopathology. Now you had taken a good slide, but if you try to dump many sample in a single container, then again it will not be fixed properly. Or if while collecting the fresh, there will be a huge contamination of the RBCs, so that your complete formalin will be contaminated with the RBCs. That also will hinder the fixation process. So like whenever you are getting a samples, try to keep with you maximum for 24 hours. 24 hours. Then while sending, you change the formalin and submit to the laboratory. That will be very much helpful, so that there will be a good penetration of the formalin into the tissue, so that we can appreciate the better histopathological changes. So as I said, like here, the last picture, maximum your sample is to 1:10 ratio has to be there. That amount of formalin, clear formalin has to be there for the proper fixation. So once you know what you should not do, then you will come to know what you have to do. There is a brief guideline for histopathology. Like that, there are two essentials you have to follow in histopathology. Always your tissues has to be maximum of fresh tissues. So fix it as soon as possible. Put it in a formalin. If not, you can keep it in a refrigerated condition. That is in a 4 degrees Celsius. You can keep. Don't freeze it. Because if you freeze, once you take out, it will be thaw again. The architecture of the tissues will be gone, and fresh tissues may be infectious. If you means if you preserve it for a longer time, then it will be more infectious and proliferation has been done, and again it will go waste. And sometimes you may forget, or you will keep it out. Don't dry out the tissues also. That again also distort the tissues. So as early as possible, you try to fix the tissues as in fresh conditions. And also the second thing is proper penetration of the fixative has to be there. That means the abundant amount of formalin is needed, because for example, the formalin has a capacity to penetrate into the tissue, for example 1 mm per hour, like that means so that it has to be penetrated within 24 hours, so that as like your fresh contour will be maintained in fixation. If you are not keeping 1:10 ratio, then again it will go waste. If you are submitting any cavities or cysts, try to open up so that it will be fixed properly, so that the perfusion of some specimens will be there. As I said, thickness is very important. 0.5 centimeter to 1 centimeter is needed. And as like you are thinking 1 centimeter means, always you try to take along with the normal and abnormal. The larger tissues will take many days. If it is a larger tissue, make a series of incision 1 centimeter apart and give a sufficient time for fixation. The formalin preserved tissue can be kept in the room temperature itself. After this, you send the sample to the laboratory. So these are the brief guidelines and how to conduct a systematic postmortem examination. Now we'll see very important few diseases which already had seen in the field. That is the pathognomonic lesions. Firstly, we will try to see about the blue tongue disease. Blue tongue is an field outbreak occurred in Thoothukudi district. Here you could in 2015, that too exactly after the post monsoon season, there was a very heavy rainfall during the November. At the end of the December, there is a severe multiplication of the or the proliferation of the Culicidus vector. So the blue tongue is an arthropod or vector-borne disease. Here we could the first picture we could able to see the severe edematous lips along with purulent nasal discharge, and rhinitis also there, glossitis and stomatitis was observed in the first picture. The second picture, cyanosis of the tongue was visible along with the gum bleeding was also there. The important thing you could able to see in the third picture, down picture, is the coronitis or flushing of the coronet is again a very important lesion you can able to see in the blue tongue disease. Here, this is a very typical picture for the blue tongue. The animal will show the torticollis or rhine twisting appearance, that is due to the degeneration of the degeneration of the muscles. The blue tongue virus will affect that area so that the animal may show typical twisting of the neck region. The blue tongue will show the typical knee walking position, that was very clear cut visible. Next, while doing postmortem examination, the important pathognomonic lesion they had observed is that the end of the aorta or the pulmonary artery, there is a hemorrhage we could able to see in first picture and also in the second picture. By this, it was confirmed, but still the record means outbreak has been recorded. The samples has been submitted to the TANUOS. Then it was confirmed with RT-PCR also blue tongue virus was then identified. After the outbreak, there is an intensive vaccination also carried in the, almost all the flocks. To control the vectors, we need to go for the fumigation with the deltamethrin. With the help of municipal, they had conducted this fumigation of all the sheep and means lamb living areas, sheds. And again, there is another outbreak in 2019, that is the sheeppox, that was showing a typical pock lesions in the oral cavity, means in the gums also the raised blisters was visible. The trachea, the means it is showing the wet form of the lesions. The trachea was showing the diphtheritic ulcers, and in the lungs also you could able to see the multiple node pock lesions. Here in this picture, in the tongue, you could able to see the pock lesions raised by nodules was there, and in the trachea there is a hemorrhages was observed. In the last picture, the lung was showing the severe diffuse involvement of multiple raised pock lesions, blisters were able to identify in that conditions. In that condition, the clinical signs observed was, as I said, in the tail end where there is some mucocutaneous junctions, we could able to see the blisters. So these are the pock lesions were observed in the sheeppox conditions. Means almost all the organs will be involved. Even the kidney also, the typical lesions were shown, multiple raised or multiple flat, not white, means lesions were observed. The next important disease in the field, you can able to see the Pestides petritis ruminant, that is pneumoenteritis complex. Another name is, as per the name, you can able to see the severe changes starting from the oral cavity, like a brand deposition will be there in means in the gums and commissures. In the tongue, you could able to see the ulcers along with the brand like deposits. In the lung, you could able to appreciate the copious amount of the frothy fluid will be there. In intestine, you could able to see the typical zebra marking, that is due to the linear hemorrhages on the alternate normal area of the intestine will produce a zebra-like marking. You can able to identify. So with this pathognomonic lesion, we could able to identify the means it is a PPR caused by the Mobley virus. And another outbreak was seen in a field condition, as Sir said, in Thoothukudi and Tirunelveli. It is highly prone for anthrax. Like we can able to see the unclotted blood around the natural orifices and all, like your nostrils and also in the anus region. If you suspect like this here, the death of the three animals, you see how they isolated the dead animals and this area after taking the smear from that fluid, serosanguinous fluid, we could able to see the typical boxcar appearance or truncated bacilli, short bacilli you can able to identify. This has to be confused with the anthracoids. That will be the length is very much longer when compared between the first picture and the second picture, and also it will be of the segments will be maximum 10 also will be there in the postmortem intruders or the anthracoids. But in anthrax it will be of mainly single or two segments will be there, and also it is a capsulated organism. So that you firstly, if you suspect, don't go open up. These are the basic means principles. If you suspect for anthrax, no need to open up the carcass. You just examine the serosanguinous fluid. If it is positive, you just um, dig out a maximum of 6 feet uh, pit. Then you put some lime, salt, and to for complete decomposition. Then you bury it very deep. That should be far away from the water source area, and this shed has to be completely disinfected with the lime, and means calcium lime. Then it has to be given some means rest period. You should not allow the other healthy animals in this shed. Like that, these condition means guidelines has to be followed in any of the anthrax. Followed by that, you have to go for the vaccination. So the other field important disease is your pasteurellosis caused by Pasteurella montecida. It is a hemorrhagic septicemia. As per the name, we can able to see the trachea will be showing a severe hemorrhagic lesions, and also the lungs will be showing a multiple consolidation also will be there. The heart also, you clear cut hemorrhagic septicemia, that is at the base of the heart region. You could able to see the multiple petechiations will be there. And if you cut open the endocardium, also will reveal severe hemorrhagic septicemia will be there. This is an acute case of pasteurellosis. Here you could able to see the clots also. This is an chronic case of a typical pasteurellosis. In chronic pasteurellosis, you can sometimes able to see the hydrothorax and hydropericardium along with the fibrin deposition. This has to be confirmed with the smears from the means hard blood smear. It has to be done with the Leishmanstein. You check for the bipolar organisms. In chronic cases, it will affect almost all the organs. Even the kidney also show the septicemic changes. Next is another important disease you can able to see after monsoon season, that is enterotoxemia. Here the clostridial, because of the clostridial infections, the severe both the serosa and the mucosa of the intestine will be highly infected and show severe hemorrhages. Condition will be visible from even from the outside of the intestine. Means if you typically you suspect for this enterotoxemia, you open up the carcass, and that will your intestine will stand out from the rest of the organs. That indicates itself. You make out a list of a differential diagnosis. In that enterotoxemic condition, another important organ you have to see, the previous slide was having the kidney that was very much pulpy. That is an important thing. Kidney will be very much pulpy. If you cut open or you just keep a scissor over the kidney will be goes as a like melting of butter or something, like it will go off. In case if you examine the brain, that will show severe congestion of the meningeal blood vessels. You take out the urine from that animal and check for the presence of the glucose. That again gives a simple identification of this enterotoxemia. And another important case is caused by the mycoplasma is the contagious caprine pneumonia. Here also you could able to see the enormous amount of fibrin deposition over the lungs. Fibrinous pneumonia will be there. And the next slide will show the severe thickening of the interstitial lobules will be there. Interstitial lobular septal thickening will be there. That is due to the blood vessel supply between the lymphatic system will be very much engaged. That lymphatic system will be involved in this separation of the lobules, so that we could be able to see the marbling of the lungs. That is a very typical lesion for this contagious caprine pneumonia. Marbling of the lungs is due to the dilatation of the interlobular septa. And another important case in the young ones, you could able to see the coccidiosis. Here you could able to see the papery white mucous membrane or very much blanched mucous membrane of the eye. You can see here the intestine. If you cut open in case of coccidiosis, the intestine will show the frank hemorrhage will be there, or the typical blood clots will be there. In those conditions, you can able to see, it means take out this clot and keep it on the slide and go for a wet examination. Clearly, you can see the enormous amount of the coccygeal oocyst will be there. And finally, in the field condition, there is a another thing you can able to see the foot rot. That is, you always have to, as I said, check the interdigital space. That is very much important. You can see the typical pus accumulation will be there. Oozing of the pus will be there. Actually, the animal will not die because of this, but because of this, animal cannot walk and go for a grazing, as these small ruminants are the grazers. So they will not go for proper grazing. They will lie down in one place, go for a inanition or starvation, then the animal will die because of inanition. So these are the all cases are field means in the field they had seen very commonly. And I will just veterological case and approach. This veterological itself a big topic, but I will just see you again in the field what are the cases they had routinely seen, or you can see some common cases. Any veterological cases, first and foremost thing you have to get the first information report from a an authenticated police inspector or sub inspector of police. You have to get it, and followed by that you make a case sheet of your hospital or your VD. Then you check for the request of letter from the request letter for postmortem examination of that concern means concerned police officer. Then you take the history, proper history. Now you go to the crime scene and see for the circumstantial evidences. Is there any poisoning of bottle, means poisoning, that means nearby any bottles or some needles, knives or something is there, or you take out the crime scene investigation. Now you then go for a carcass handling, packaging. Packaging also here in the metrological cases very much important. Storage, everything. Crime scene photo, as we had seen in the brief guideline of any postmortem, needs photos and documentations are very important, and then you write a proper technical postmortem reports has to be given. This is a case had seen in the Madras Veterinary College. Here they had given the first information report. After seeing the first information report, we should collect what may be the history, like that. You have to read the history of the case, what are they suspecting or how it has occurred, so that you can get some idea. If the animal is multiple in numbers, try to have the numbers, because each animal will be having different markings, like different colors also will be there. Some are horned, even the distance between the horns or the length of the horns, color of the animal, hoof color, everything has to be pointed out in the postmortem report. So that proper labeling is very important while taking the photography. While taking photography itself, you also have to make a note of the animal and appearance of the grass lesions. So this is a case of lightning. A mass death of more than 10 animals had been occurred in a particular area. So in that condition, if you are doing a postmortem, you can see the specific typical lesion of, like when you open immediately after opening the subcutaneous area, you can able to the arborization of the blood vessels. This is a typical arborization or lightning marks will be there. This we say is a coronographic features or the Lichtenberg features, like that, or simple arborization. That means branching of blood vessels, subcutaneous blood vessels, very typical in lightning cases. Along with that, if you open up the heart, the right ventricle will be very empty due to the sudden shock of the cardiogenic shock will be there in lightning cases. And so this correlates with the history. You also have to ask for the history and also the season based one. This one is a lightning case. Very specific marking you can see. And this is another case which occurred in means Tirunelveli Thuthukudi highways. A truck has hit over the flock which is crossing the road, so that here also around 10 animals has been died because of the truck ride over the animal. This also, like all the organs had been eviscerated. In this case, you means also you have to get in any of the veterological cases, you have to get the first information report along with the police requisition. Then only you have to go for the postmortem examination, and you need to take all the documentation, and you try to take animal one showing the abdominal viscera has been abdominal organs has been eviscerated. fracture of the femur was there, or complete organs has been eviscerated from the thoracic cavity. Like that, you need to mention the animal number 1, animal number 2, or the color of the animal. Like that, you have to record individual postmortem report for the individual animals, because that has to be a record for while appearing to the court, and also it will be helpful for the farmer while go for the claim. And this is a case during 2016. There is a flood in Kannur district. At the time, mass animal means a mass of flock has been drowned into the flood. That time, the veterinarians has to investigate the area, and here you could able to see the drowning of the whole flock into the flood. And the above picture shows they had taken out for postmortem examination. In such a conditions, you have to open up the body and check mainly for the thoracic organs. The thoracic organs, mainly the lungs has to be examined. You can see this some water creatures or algae, some crustaceans the trachea will show the some green structures. Here they had pointed out the small crustaceans that is not very clear in the picture. Still, if you suspect, you can take out the fluid and you check in the microscope. Like that you can see, or any algal presence will be there, because the animal might drink the water, means water, algae will be there in the lung or the trachea. The other things, whether the animal has been means while died while drowning, or it is died before and they had thrown into the water, you have to go for the lung flotation test. That means if the animal is died and then thrown into the water, means your lung will float. And if the animal is drowned into the water, means your lung will be sunken into the water, because already the lung is filled with the water. It will be very heavy and it will go into the water. And this is another case they had seen during a summer. These are the kids they kept inside their shed. Like the farmers used to have the habit of daily closing this. We say that food. That means it is of covering for the young ones, that to prevent from the predators. They will not keep in a shed area, that they will keep it in a closed cavity, means closed living area. That farmer went to went for grazing of the adult animal. He left these kids in this closed area. While returning after that grazing, they found all the animals had been died. They were suspecting for some other toxicity or something, but this is due to during the summer season they closed it, and also the number of animals kept in a single shed is very heavy. So due to the improper ventilation, the animal was suffocated severely. This we can able to identify in the next picture. While opening the carcass, they could able to see the lung was showing severe pulmonary edema, congestion, alveolar emphysema, hemorrhage will be there, was there. So they could able to identify if the animal was severely suffocated during the because of the summer season, and also the improper ventilation, and also overpopulation in a single shed. While going for the examination of suffocation, you have to check whether it is due to the air insufficiency, or because of the any foreign material might have choken into the trachea, or sometimes in a poisoning case also you can able to see these cherry red appearance, that you have to differentiate with, or you have to take the samples. And also in the suffocation might be due to the manhandling also. At the time you check the neck region, abrasion or contusion will be present in the soft tissues. And coming to the thermal injury, there's a means it depends upon the degree of burns the animal might have died. Means like in the superficial first degree, there will not be death of the animal. This second degree and the third degree will go if it is more than 50%, the animal might, there might be chance of loss of the vital or organ function, so the animal might have go for die. And fourth degree, there will be the complete charring of the animal body will be there, then that leads to the death of the animal. This is a picture had given by one farmer. Means due to the firing of the whole farm, here you could be able to see the charcoal of the presence, and also complete charging, singeing of the hairs. Means typical rigor had setting very fast, and also your skin has been peeled off, stretching of the skin has occurred, so that this is completely all the vitals has been gone. and also because of that it lost the life. Another thing, here also you have to go for a differentiation between whether the animal is burnt alive or burnt dead. How we can identify this is, if for palm or assured head is burnt, means the animal might have inhaled the fumes of that burnt area, so that you cut open the trachea and check for the charcoal presence or the carbon fumes inside the trachea and the lungs, so that like that you have to identify. The last case is poisoning. This is a poisoning case, means complained to the by a owner. And another thing, if you are doing a postmortem exam, veterological postmortem, you keep a means the sub inspector of police or any police personnel along with you for a reference, and you avoid the other public people that will misinterpret your diagnosis or misinterpret your procedures. So then, if you suspect like that, you keep the personnel and the owner only along with you. Here also you have to check for the circumstantial evidences. As I said, if you are suspecting the poisoning case, all of your stomach content, intestinal content has to be taken along with your metabolic organs like your liver, kidney, and intestine has to be taken in with a loop. Means it has to be tied with a loop. Stomach contents separate. You have to collect here. You have to collect the organs in a separate container, not in a single container. Stomach and intestine has to be collected separately. If you are collecting a paired organ, separate whole organ or tube, or maximum of 500 gram of the sample has to be kept in any of the poisoning cases. This is the stomach content we have to collect for the any of the poisoning cases. As I said, that has to be separately collected in a saturated saline solution. And coming to the packaging, it has to be packed with means very neatly. It has to be packed and it has to be kept in a erect, that is a seal. It has to be kept along with that. Our department seal or your VD seal is there, means it has to be kept over the sample so that it should not be broken. And it has to be kept in a triple packaging system that to avoid the leakage. That means your important sample has to be the primary receptacle. Over that, you have to keep some absorbent over the primary receptacles. The cotton or some absorbent has to be kept so that if it leaks, also that has to be absorbed by the cottons. In the secondary packaging, you can keep your history sheet and also sampling records of what are the samples inside that, and who is your consignee, who from where you are collecting, and all those has to be there. And outer packaging from over that also you have to mention from and to address, and it has to be indicated that which is upside and downside, because we are sending a biological material along with the fixatives, so that it should not be kept upside down. And if it is a you are suspecting it's a biohazard, you make it a symbol, means print a symbol over that, handle with care by infectious material, biohazardous is there, like that you have to keep. Try to keep some proper packaging that, so that it will reach the laboratory or forensic laboratory, so that they have to fasten accordingly go for the diagnosis. Final takeaway homemade means takeaway message or take home message is, always try to get the thorough history and systematic approach as indicated in the pie chart. Our history itself maximum gives the 50% will give the diagnosis. Rest of the diagnosis was done by gross and histopathology, followed by any of the molecular means diagnostic material techniques like your PCR or ELISA, culture, like that. That will include only 20%. Then proper histopathological sampling. Your field work should not be go waste, means you have to submit a good proper histopathological sampling. And finally, means an important thing you need to know at the field level, preparation of 10% formalin is very much important. Like 1 part of 30%, 37% formaldehyde, that means has to be diluted in 9 parts of tape water. That is 100 ml of formaldehyde in 900 ml of water has to be has to be diluted and kept for the fixation of the tissues. Means like as I said, minimum of 24 hours you keep with your area, so that it will go for a proper fixation. Then you change the formalin. While transportation, you just send it in 1:2% of formalin. For fixation, you go for 1:10% of the formalin. As I said, very important, please avoid the glass bottles, it will break. And also don't use the narrow bottles. Use the wide mouth bottle containers is very much important. And double labeling is also very much important. Sometimes the lid and you might have written in the lid and you left the container, means there might be a misplacement of the lid and the container. So you label container and the lid, and always the sampling has to be less than 1 centimeter thickness, and also along with the lesion and normal tissue has to be submitted. And you try to give a minimum, means technical postmortem report writing based upon the morphological descriptions already we had seen. And if you are seeing some respiratory involvement, try to make out a list of differential diagnoses like hemorrhagic. If you are seeing edematous lungs or hemorrhagic lungs, means hemorrhagic septicemia or PPR, like that list of differential diagnosis has to keep in our mind. Then approach on veterological cases. Your veterological cases will be has to be taken in detail, but still the first and foremost FIR has to be there, police personnel has to be there, and you try to take the proper sampling and submit as far as possible. So these are my take home message and a complete gist of my whole presentation. Hope it serves purpose to all the means all those who attended participants. At this juncture, I would show my gratitude to my mentor, Dr. Ashwida sir, and also the maximum photographies were shared by Dr. N. Balmurugan. And the ideology behind making the PPT is maximum done by Dr. Tagapanin sir. He has given the input, and then a few photos are has shared by Dr. Kumar sir, Arlanandam, and also one of the field veterinarian. And I would thank my university, Tanvas, and also Gadwasu for making me like this pathologist. And of course, I always thankful to the animal husbandry department and Tamil Nadu. I also had been worked as a veterinary assistant surgeon. That gives means an experience how to approach in the field. And few of the photographies had been taken from the internet sources. So I thank everyone.